Dr. Anna, it's such a pleasure and an honor to speak with you today. I'd like to, jump into our conversation with why it's so critical for health and wellness during a pregnancy. What is it that we don't know about this particular time and why it's so important?
Yes, thank you. Thank you so much for that question. That question is very important to me because I'm a public health physician. I've been working on maternal health, maternal and newborn health for years and years. And this is something that we are very concerned about and working hard to improve both health and wellness for the mother and the baby. So, the conditions under which a woman reproduces affect her own health and well being and that of her child and indirectly the entire family. So let me give you two examples. Let's think of a woman who had a happy and healthy childhood and adolescence, who was able to choose the time of her pregnancy, who has the right nutrition, who has the right social support, who has access to good and timely maternal health care. So she's very, very likely to have a normal delivery with no complications, a happy one. She'll probably have time to fully focus on her newborn for the first months of his or her life and breastfeed. The outcome will be wonderful. On the other end of the spectrum, you can think of a woman who wasn't well nourished during a childhood, who didn't get the kind of stimulation that children need, who didn't get the vaccines to stay healthy, who probably didn't know how to avoid a pregnancy during adolescence, and once pregnant didn't have the resources to get the care that she needed. She has to go back to work immediately. She doesn't have anyone to support her to breastfeed and take good care of her newborn. So that woman, unfortunately, is more likely to have undiagnosed complications and she won't have a good experience in terms of health and well-being. And when I say health, I mean comprehensive health, not only physical health, but also psychological, spiritual, and health in all senses. So obviously, those are the two extremes of a spectrum, and most women fall somewhere in between. And luckily, pregnancy and delivery and the postpartum period are normally physiological processes, so are normal processes that lead to a good outcome. But it's true that in many cases, there are complications that could happen to any woman anywhere. So those complications may have a devastating effect on the mother and the baby as well. And they are particularly important when women face barriers to access timely care, because we as a health community have the knowledge and the resources and the tools to either prevent or manage most complications. But many women, unfortunately, and families don't have access to those tools because they are particularly vulnerable due to age, due to socioeconomic status, due to race, due to the place where they live. So there are so many factors that may interfere with good health and wellness during pregnancy and beyond. And obviously, those conditions don't limit its impact to the maternal health period, so pregnancy, delivery, and the postpartum period, but in fact affect the health and well-being of the mother in later stages of her life as well, and sometimes across generations.